Good afternoon, everybody. This is Nuna Phillips at CLASP. I want to thank you on behalf of the entire ASAP team for joining us this afternoon for the webinar on CCDBG. This is the second webinar in our series, and as topics and dates are finalized for future events, we will of course communicate that information to you. Please also note, just for those of you who may not visit the ASAP Secure website often, that the last recording and presentation that Jen did in mid-January is now available on the website. So you can go there and find that recording. That was, of course, on the topic of understanding and leveraging technology to promote integration. Today's webinar will also be posted on there, so I'm hoping to have that up by the end of the week. And before I hand it over to our guest presenter, Hannah, I just wanted to mention a couple of housekeeping items for the day. If you dialed into this webinar using your phone, be sure to mute your computer speakers, because if you have both on, you might be getting an echo or other kind of a disturbance from having two audio sources. If at any point during the webinar you have a question for our presenter, please either use the chat feature or the question feature that you should see in your control panel, and we'll make sure that Hannah gets those and answers them as she can during the event. And if during the webinar you have any technical problems, feel free to chat me directly using the control panel chat feature, or you can email me at nphillips@clasp.org, and I'll try to help troubleshoot any technical problems during the event. We're very excited about today's webinar. It's an overview of the Childcare Development Block Grant, CCDBG, which I will not say 10 times fast. We're very fortunate to have Hannah Matthews as our guest presenter today. Hannah is the Director of Child Care and Early Education here at CLASP, and she's an expert at both the federal and state levels in terms of child care programs and early education policies that support healthy child development and the needs of low-income working parents. Hannah has authored and co-authored many publications, and you can find those on the CLASP website, and I highly encourage you to access those resources for additional information, as I know this topic is of interest to many of you. So with that, I just want to thank Hannah so much for joining us today. And Hannah, go ahead and start whenever you're ready.
Great, thank you. Well, I'm really excited to be with you all today to talk about the child care reauthorization. We will hold time for questions at the end, but as Nuna said, if you have questions as we go, please feel free to send them in through the chat function, and I will do my best to address them as we move forward. So what I wanted to do today was to provide a broad overview of opportunities in the new Child Care and Development Block Grant reauthorization and talk about the timeline for implementation in the states. I'll also share a bit about the context for CCDB reauthorization, what state child care subsidy programs are kind of experiencing right now, and I also want to let you know about CLASP's work with states on reauthorization and point you to resources that we hope you'll take advantage of, which include seeing myself and other staff here as resources that you can call upon in your own work. My understanding is that we likely have varying levels of engagement on child care subsidy policy among the groups represented on the call. So I'll attempt to not get too far down in the weeds, but if you want more detail or need clarifications as I go, please do ask. So in November of 2014, Congress passed a bipartisan reauthorization of the Child Care and Development Block Grant, CCDBG, for the first time in 18 years. You may know CCDBG as the Child Care and Development Fund, CCDF, or by your individual state program name for child care subsidies, but they're all one and the same. And this is the major source of federal funding for child care assistance to help low-income families go to work or to go to school and to support improving the quality of child care for all families. CCDBG is a block grant. It has always permitted a great deal of state flexibility within very broad federal parameters. The reauthorization established many new requirements for state and in many ways was attempting to make CCDBG a bit more like a program than just a funding stream. That said, there's still a great amount of state flexibility in a number of key areas, which means the implementation really will be different from state to state. Hugely important, the reauthorization did not guarantee any new funding to comply with new requirements, many of which are very costly. Congress increased the program's discretionary funding, the authorized levels, pretty minimally, but that funding must be appropriated each year, and I'll talk a bit more about that. So in broad strokes, we think of the reauthorization and the opportunities it presents in three categories, and I'll go into each of these in more detail. The law seeks to protect the health and safety of children in childcare through more consistent standards and monitoring of those standards. It also attempts to allow families to more easily access childcare assistance that supports stable and continuous childcare. CCDBG currently is a notably unstable support for many families. States typically have very burdensome requirements for eligibility redetermination and reporting during eligibility periods that ultimately result in families often leaving the program even while they're still eligible. So the goal here was to really make the subsidy itself a more stable financial support, which then leads to more stable and continuous care for children, recognizing the importance that we know of a stable caregiver relationship for children's development. Finally, the law also intended to improve the quality of care by increasing the share of CCDBG funds that are spent on quality, and also including some training and professional development requirements and opportunities for child care providers, including more stable financial support for providers. There also are some provisions to build the supply of high-quality care for particular populations. And again, I'll talk a bit more about each of these. Before I get into the specifics of the new law, I really do want to spend a bit of time on presenting the context here for reauthorization. The chart that you see here shows total combined CCDBG and TANF spending on childcare from 1997 to 2013. You likely all know that states can spend TANF funds in two ways, by either transferring a share of TANF funds to CCDBG or by spending them directly on childcare. So this chart includes both of those. We have just gotten 2014 expenditure data, and it does show that spending is now at $11.3 billion, which is the lowest level since 2002. And this is because of declines in both CCDBG and TANF. Federal TANF funds used for childcare are the lowest level they have been since 1998, having fallen from more than $4 billion to about $2.6 billion. So there's much less investment going towards childcare subsidy currently. We were really fortunate to have received an increase of $326 million for CCDBG in the recent federal budget agreement, but that really is just a very small share of what's needed to implement the law and won't in any way make up for the ground that we've lost over the last decade as the value of the block grant has declined. I do want to show you here the state-specific spending information that we have for 2014. We can certainly follow up offline if you're interested in seeing trends over time, but we just thought it was useful to include here a little bit of a snapshot of your own state. And the reason we have the transfers at the end there is because they are not included in the total sum of spending, because they are included once they're transferred. That money is spent as CCDBG dollars and appears in that first column. So not surprising when we consider the decline in spending, we can see here that the number of children receiving CCDBG-funded childcare is also at the lowest level in the history of the program, at just 1.4 million children now in 2014, which is the most recent data we have. This chart is just CCDBG-funded childcare. We don't have data on the numbers of children served through TANF funds directly. The most recent federal estimates of children receiving childcare assistance through all sources is that we're serving about 15% of those children who are eligible under federal rules and about 25% of children who are eligible under more restrictive state rules. And you can see from the chart from 2006 to 2014, we've lost nearly 364,000 children from the CCDBG program. And again, I can direct you here to what that trend looks like in your own state. We show 2006 was kind of the high point of nationally of the number of children served in the program, and so you can see there the most recent numbers from 2012, 2013, and 2014, and then the comparison to 2006. I do also just want to draw your attention to recent analysis that CLASP has done on the share of eligible children served in each state in CCDBG by race and ethnicity. The overall story here is that very few eligible children, regardless of backgrounds, are served because of insufficient funding levels, but we also see really variable access by race and ethnicity, and in particular, very limited access for Latino children, likely as a result of the lack of growth in funding with emerging populations, and also likely having to do with some state policy choices as well. If you're interested in this, please feel free to check out our webinar that we're having on this report next Thursday, and we can send you the information on that. So a little bit more context here in terms of current state policy. As I mentioned, states have a lot of flexibility to set their eligibility rules and their program rules under federal parameters. So even though the federal law allows families to be eligible for child care up to 85% of state median income, in reality, all but one state set their income eligibility far lower than that. And if you look across the states, a family whose earnings are above 150% of poverty would only qualify for assistance in 34 states. That's also the upper level of who is eligible. States prioritize families with very low incomes. So most families receiving CCDBG have incomes that are actually below federal poverty, and nearly 80% of families have incomes below 150% of poverty. Rates paid to child care providers across the country are also distressingly low. There is only one state in the country that sets its payment rates at the federally recommended level, which is the 75th percentile of a current market rate, or in other words, about the amount that would allow a family to purchase about 75% of the child care in their particular community. The rates, of course, are important because that's the money that goes to providers. It determines whether they can make quality improvements in their program, whether they can pay their teachers a living wage. And when rates are low, we see providers really limit the number of children with subsidies that they can serve. And so this is a real determinant of what access children in the program have to the full range of child care. The last bit of context that I want to mention that I probably don't need to tell all of you, but is really important as we think about the changes in CCDBG, is keeping in mind the changes in the low-wage labor force that are simultaneously happening. Low-wage workers increasingly, as you know, navigate job schedules that are non-traditional, variable, and unpredictable. These volatile job schedules exacerbate the complexities faced by low-income parents trying to access quality childcare and to maintain childcare subsidies. You can just imagine how difficult it is to access stable childcare when you don't know more than a week or two, if that, in advance, what your work schedule is going to be, and you can't plan for that. It's also the case that the way that many childcare subsidy programs operate, families with volatile schedules have a very hard time complying with reporting requirements or strict rules that really link the work hours and the childcare authorizations very tightly. So that's something that is potentially can be addressed through the reauthorization, but is an ongoing kind of challenge for the childcare field. I would say through the law and also both at the federal and the state level for some time, there has been a focus on continuity of care and also increasing access to quality childcare. Again, these two things can be seen both as opportunities and challenges when we think about low-income families accessing the program. It's important to think about how parents with challenging work schedules can access stable quality care, but we also have some concern that a focus on accessing very high quality care may in fact exclude some families who need care on the nights or the weekends or likely need informal care to be able to support their work hours. So it's a complicated issue, and I'm going to talk a bit more about it, but important to have this as context for the changes that are occurring. So where are we on the reauthorization? As I mentioned, the bipartisan CCDBG Act was signed in November of 2014. States have been looking at the law over the last year and thinking about their implementation plans. In December of last year, ACF released a notice of proposed rulemaking, proposed regulations for the new law. That was at a time that states were very deep in their own planning. And in fact, I'm sure many of you participated in hearings or submitted comments on your state plans. Those plans that basically report on how states are going to implement the law are due today to the Federal Office of Childcare. We do anticipate that there will be final rules in the summer. So that will mean that states will have to make some adjustments to their plans at that time. If there are rules that become finalized, then states would have to make amendments to their plans. So this is a very fluid process, and implementation is going to happen over quite some time. The deadline for compliance with most of the provisions was actually upon enactment. The Office of Childcare has said that states have until September 30th of this year to comply with those acts, and then there are particular provisions that have delayed effective dates. So I just want to note that I'm not going to discuss all of the provisions in the law. We don't have time for that. So this is going to be a select overview, and again, I'm happy to follow up with questions either on the webinar today or at a later time. So going back to those three buckets that I mentioned at the beginning of the call, the first being health and safety of children in childcare. The law established minimum health and safety standards, including pre-service or orientation training and ongoing training requirements for providers who receive CCDBG in 10 specified topic areas. These are pretty basic areas, such as the prevention of SIDS and safe sleep practices, first aid, CPR, prevention and control of infectious disease. It may surprise people that these are not required trainings for child care staff across all of the states, but they're not. While these trainings are clearly very important to caring for children, there are questions about who will pay for the training, the capacity of existing systems to meet the needs of providers, so that trainings are available to providers that work at different hours, that they're available in multiple languages. I would note also that these trainings really increase the amount of trainings required in most states for license-exempt providers, those providers who are not in the license system by the state, and there may be some additional challenges for those providers being able to complete the trainings in the required time. The law also requires pre-licensing inspections and annual on-site inspections for all licensed childcare and annual inspections for all CCDBG providers, including license-exempt providers. Again, this is new for many states. States do not do annual inspections for all of their licensed childcare, in particular family childcare providers. Again, it's going to vary by state here what the current monitoring system is, but the vast majority of states do not do inspections for license-exempt providers. So that will be a new cost area for states. And again, it's a challenge to really figure out who is the most appropriate to conduct these inspections, what's required, how does this get done for providers who are caring for children in the evenings or on the weekends or at varying times. The law also includes comprehensive background checks for child care providers. This includes both CCDBG providers who are license exempt unless they are caring for only children who are related to them. And it also applies to all child care staff in all child care settings, regardless of whether they get CCDBG funds. The checks are very complex. There are 5 different checks named, and it includes some cross-state checks that most states currently are not equipped to do. So there's some pretty big challenges and big cost implications for states in this area as well. So an area that we are really excited about and see a lot of opportunity are provisions around improving access for working families and making subsidies more stable. As I mentioned at the beginning of the call, that kind of bucket around the stability of the financial support and continuity of care for children really is a strong component throughout the law. Probably the biggest change, and one that's been talked about the most that you may be familiar with, is that the law established minimum 12-month eligibility for all children in CCDBG, regardless of temporary changes in parental employment and regardless of changes and specifically increases in income up to the federal maximum. So prior to the reauthorization, about half of the states already had 12-month eligibility, but that was a maximum period of time that a parent or a child might be approved for. And then in practice, because states require families typically to report every change in job, every change in earnings, any change in household, and often would adjust the subsidy because of that change, we had a tremendous amount of churn in the subsidy system, resulting in families typically only receiving their subsidy for about 4 to 7 months. So a continuous 12-month eligibility is fundamentally different from how the program operates in nearly all of the states. The law does include a state option to end assistance for what's considered a non-temporary job loss or cessation of education or training. And if the state chooses to do that, they have to provide a minimum of 3 months of job search before ending assistance. So the guarantee of job search is also a new provision. The proposed regs that came out attempted to clarify this idea of what is a temporary change or a non-temporary change. It lists a number of conditions that would be considered temporary, such as maternity leave, a seasonal employment, breaks in school semesters, and it basically seeks to define temporary changes as anything lasting for fewer than 3 months. And again, those rules are proposed at this time. They're not final. The law also instructs states to provide continued assistance to families at the point of redetermination who remain eligible for child care but whose income has exceeded the state income eligibility but below the federal maximum. So to say this another way, because states set their income eligibility well below 85% of SMI, if there's a family who at their redetermination after 12 months continues to be working and meeting other eligibility criteria, they should continue getting assistance for some time. The proposed rule has put out an idea of what that graduated phase out should look like. It's been one of the more, I would say, controversial proposals in the reg, so there have been a lot of comments both from those in state agencies as well as or advocacy organizations in terms of how to operationalize the graduated phase out, and I can talk about that more if there's questions. Another piece in the law is on instruct states that their redetermination processes must not require parents to unduly disrupt their employment in order to comply. It's not exactly clear what that means, but again, we think that's a signal to really be taking a serious look at simplifying eligibility and redetermination policies and making them much more easily accessible for families. And I would say that the proposed rule builds on much of this continuity language in the law by really establishing parameters around things like interim reporting requirements, adjustments to co-payments that states frequently make for families, kind of many of these other policies that really relate to whether families stay on or fall off the child care assistance program. So again, we don't know what the outcome will be in final rules and which of those provisions will be in a final rule. So the third area that the law looked at was around improving the quality of childcare. The law requires and has always required a share of CCDBG to be spent on initiatives that improve the quality of childcare. Previously, this was a 4% set aside. The law has increased that amount over 5 years to 9%. It also has authorized a 3% set aside to improve the quality of infant-toddler care. Previously, there was a set aside for infant-toddler care that we got annually in the appropriations process. That's now been authorized in law, and in fact, the 3% over all of the CCDBG funds will be a much larger amount than it was previously. So it's a real opportunity to focus in on a segment of childcare which is the most unaffordable for families and often the lowest quality for children. There are also professional development and annual training requirements. States are to provide for childcare providers. The extent to which those professional development systems that states have will be successful in helping teachers get higher credentials and degrees and be linked to higher compensation will, of course, require resources. The quality set aside is a potential source for that funding, but the quality set aside is often used for many of the very basic health and safety requirements. So if you think back to the requirements around training, around the annual inspections, around the background checks, many states fund their licensing systems through the quality dollars. So while there will be more quality dollars available, it's a question as to where those funds will go. There is specific language in the law around supply building of quality childcare for underserved populations, and the law lists a number of groups of children, including children in need of care during non-traditional hours. So we are hoping that that might be an opportunity to see some innovative strategies there. The last bullet here is that the law has instructed states to pay providers based on generally accepted payment practices for childcare providers who don't receive CCDBG funds. So what does that mean? So I pay for my son's childcare a month in advance, and I pay a full-time rate, and I pay for every day of the following month, regardless of whether he's going to get sick next week and be out of childcare for a week. So that would be generally accepted payment practices. The law doesn't go so far as to say that states have to do that precisely, but they are expected to pay for absent days to the extent practical. The proposed rule describes to states some acceptable payment practices, like paying on a full-time basis or part-time basis rather than paying by the hour, as some states do, or even smaller increments, as at least one state does. So the idea is to really stabilize the subsidy as a source of financial support for childcare providers. And there's been a bit of research in this area that finds that it's not just the low rates that make it difficult for providers to actually accept children receiving subsidies, but it's the instability of the childcare subsidy as a source of revenue. So if providers don't get paid on a timely basis, and if the amount that they're paid is constantly adjusted by the child's attendance or other factors, it's very, very hard to predict, to pay your basic expenses, but also to predict what your revenue is going to be and to be able to make quality investments. So we think that providing some stability to childcare providers is a really important improvement in the program. So I want to come back and focus on a couple of areas that I think are particularly interesting for this group. One is the connection between CCDBG and low-wage work, as I talked about at the beginning. The improved subsidy policies really do offer an opportunity for states to better meet the needs of parents in low-wage jobs with non-standard hour work or variable work schedules. If states implement more stable eligibility policies, as well as those payment policies that really de-link work hours from child care authorizations, it makes it possible for families to access and retain assistance. So So for example, one of the reasons that it can be hard for a family with a volatile schedule to access subsidy is because their childcare may be very tightly arranged to the work hours. And so if you're allowed 3 hours of a childcare authorization one day and 9 hours another, it's very, very hard to secure formal childcare, which typically requires a space to be filled either on a part-time or a full-time basis. So doing some of this delinking between work and childcare authorizations can really help support some of these families. And as I mentioned, there's also some opportunity for quality initiatives to target the needs of children whose parents work non-standard hours. The challenge here, however, is that there is, without new resources, a real risk of trade-offs. Obviously, providing more stable childcare to some families will make it likely that without more resources, waiting lists will grow and other families will not have access to subsidy. We also are concerned about some risk of really limiting childcare options for families, in particular families that really need informal or license-exempt care to be able to meet the hours that they work. When states consider the additional costs of bringing these providers, getting them training, of doing the inspections, it may be that they begin to make other decisions about letting families access the full range of providers. And we do think in some ways the law encourages states to direct families towards higher quality care, and we do have some concern that that may not be accessible for families. The law, I want to talk a little bit about alignment here with other programs. I think this is an area where we actually still have quite a bit to learn, and look forward to kind of working with states and seeing how this plays out. CLASP, through the Work Support Strategies Project and other technical assistance, has worked with states to align child care subsidy with other programs. The first step of that work was always about simplification, because child care subsidy policies are so burdensome and cumbersome, and the law really does support simplification, so we think there is some potential there. The law, at a very minimal level, does require states to provide consumer information on a set of programs, and the ones listed here are explicitly articulated in the law. But then in terms of actually aligning child care eligibility and enrollment with other programs, I think this is somewhat of an unknown. Previously in our work with states, we were able to present CCDBG as kind of the flexible partner. It really didn't have many of its own federal eligibility policies, so states could easily adopt SNAP or other program rules to align child care. In some ways, the reauthorization does support that continued alignment, and I think we've worked really hard to make sure that there aren't provisions in the proposed rule that would preclude that. But on the other hand, it does require states to do some new thinking about the interaction between programs, in particular because what was an actionable change for families previously, an action that a household change that a state may have adjusted the subsidy, they may no longer be able to do so. So the way that program data is able to interact with one another is really very different now. I wanted to mention TANF specifically. TANF-funded childcare, those TANF funds that are spent directly on childcare are not held subject to the CCDBG rules. On the other hand, once a state transfers transfers TANF dollars to CCDBG, all of the rules of CCDBG apply to those funds. About 14% of families in CCDBG also report getting income from TANF, and that amount varies by state significantly. Those families will all be held to all of the same CCDBG rules. So the 12-month eligibility that I talked about, the 3 months of job search before ending assistance, all of those rules apply. Just this week, the Office of Child Care and the Office of Financial Assistance, the Fed at ACF, have put out joint guidance that clarifies some of the CCDBG rules around serving TANF families. It also talks about the opportunities to have to think about TANF and rethink those child care policies and think about adopting some of the same rules. And one proposal specifically that's been put out through the president's budget this year was to make sure that all childcare funded with TANF dollars met the same health and safety requirements as CCDBG. Now that would require actual congressional action to happen. It's just a proposal, but the guidance put out by ACF talks about a number of ways where states could look at the opportunity of the CCDBG reauthorization and really think about the alignment and coordination between TANF and CCDBG. And I think what that looks like in individual states also varies dramatically. So I know some of you have been involved in state plan hearings and submitting comments on draft plans. As I mentioned, those were due to the Federal Office of Child Care today, so we're at the close of the first stage of implementation, but really it's just the beginning. State plans are a blueprint, and if you read some of them, they do not provide a very specific blueprint yet for state implementation. So this is a very fluid process. The plans will become effective in June. There may be some back and forth between the federal office and states between now and June. And then again, there may have been state-specific implementation timelines submitted in those plans, and a final rule may require some plan amendments. So it's important to keep working on the policy change. We really think this is a time for budget advocacy, and if any of you are interested in supporting that, we're happy to help. We're happy to help connect you to those others in your state that may be working on this. One of the reasons that the implementation of CCDBG is so challenging is that it really is state-specific. In each state, the changes, whether they require administrative or regulatory or legislative actions, it really depends on the state. In some states, everything down to the specific training and coursework that providers are required to take for CCDBG is in legislation. In others, some administrators can more easily do some of these changes through administrative action. So it's really important to try to figure out what the case-by-case basis is in your state. The state cost estimates are also really important. We have some states have done estimates of particular provisions, and these have been very useful both at the federal level in our advocacy for increased funding and also at the state level. So that's another area to think about in terms of connecting with others on advocacy around the implementation. And then we think it's just going to be really important to keep track of what's happening in states. The state plans are really, really just the beginning. There will be legislation, there'll be rule changes, there'll be policy manuals, there'll be applications, there'll be guidance, there'll be all kinds of things happening and needing to happen in states and at the local level to make sure that the implementation really, really is carried out and fulfills the vision of the law. And we know that what can happen between actually passing a law and making a change for an individual parent who walks into a subsidy office, we know that that can be a very long process. So we're in it for the long haul. And we think it's really going to be ultimately important to hold states accountable. The new law is radically different from how states operated previously in terms of their flexibility to set eligibility and other rules. And so there's going to be a lot of work to be done to really move to what is fundamentally a very different program. I know we're getting a couple of questions. I only have one more slide, so I'm going to keep going here and then answer some of the questions. So just some concluding thoughts. As I said, this implementation is challenging. Another piece that's complex, besides kind of the range of legislative to regulatory changes needed in states, is that the reauthorization really may apply to many different entities in the state. So for example, in some states, the licensing agency is different from the subsidy agency, and the subsidy agency may be different from the agency that administers the quality dollars. So all of these interactions make it really complex and need to bring a lot of players to the table. And again, given the vast amount of new requirements and the time constraints for implementation, it's really challenging. It's going to require resources. I know I've said that a number of times, but I have to keep saying it because it's so important. And it's an opportunity, we think, to really think broadly about how a child care subsidy program can really support low-income working families. And I think this is an area where it's going to be up to advocates to really push on some important provisions. States are focused on compliance, and they have good reason to be, because, as I said, it's complex and they're dealing with very short timelines to make a lot of change. So it's really going to be up to all of us to kind of help them see beyond just the compliant phase and really think about making some more fundamental changes. And then again, we're just trying to always make sure that we keep in mind the two-generation goals of CCDBG, which is supporting both parental employment as well as children's access to quality care, and making sure that we're not shortchanging one for the other, because it's really important to be holding those two ideas in our head at the same time as we move forward on the implementation. So as I answer questions, I'll just put up here some resources, both from the Federal Office of Child Care as well as CLASP reauthorization page. We put out an implementation guide jointly with the National Women's Law Center a few months after the law passed. That's the picture that you see there. It doesn't include the latest information on the proposed reg, but it does talk about a number of choices for states, both opportunities and challenges in the law. On that reauthorization page, we also have a number of state-specific resources, including some fact sheets on where your state stands in relation to some of the key provisions in the law. So again, I hope that you'll use that information, but also reach out directly if there are state-specific questions or things that we can help you with. So I'm going to take a couple of questions that I've had and go ahead and keep sending them in as we're talking. So one of the questions is whether I think that the additional requirements without new funds will lead to longer waiting lists. Unfortunately, the short answer to that is yes. I think one of the challenges here is that it is difficult to predict what exactly the consequences will be of some of these new requirements without resources. So because states have flexibility, it's hard to know what they'll do to be able to meet the requirements of the law. So for example, one option is if you serve, families with a longer subsidy, a more generous subsidy, you grow a waiting list. It's also certainly possible that states could lower their eligibility or add additional state eligibility criteria to further restrict who is eligible. One example, something we're concerned about, is whether states will favor some families over others. So for example, serve families that are working opposed to families that are coming in because of education or training needs. So I think while we do expect to see waiting lists grow, I think there's a number of possible unintended consequences, and it's a little bit hard to predict right now exactly which way some of that will go. So another question is whether or not the new requirements will lead states to draw more funds away from TANF. It's an interesting question because I actually, so again, this shows how much we all just don't exactly know which way it's going to go. I think that is one possibility. If there is a state that does a good job of advocating for more resources and sees TANF as an opportunity to increase funding for childcare, we actually have some concern that things may go the opposite way, that in fact states that want to hold on to more TANF funds and not transfer them and serve TANF families directly through TANF will do that to avoid some of the costly requirements. And we have some real concerns about thinking about creating kind of a two-tier system where families that go in through the TANF door don't have access to the same level of care that meets the same health and safety standards, that don't have access to a more stable assistance, and then families that enter through the CCDBG door have a whole other set of childcare available to them. So I think thinking about how that's going to play out in states is worth conversations, and I think there's some real concern there, particularly both in kind of how the TANF childcare and the CCDBG childcare operate, but also about those transitions, because we know right now that in a lot of states that point from when a TANF family moves off of TANF and is accessing CCDBG subsidies can be a time of real instability and can lose that subsidy. And so this is a new opportunity to think through alignment and coordination across those programs. Another question is on a best practice recommendation for implementing 12-month eligibility in coordination with other programs. So I'm sure that we can send out resources after this call. Through the Work Support Strategies project, we actually, CLASP and the Urban Institute, wrote a very lengthy paper on how to coordinate childcare with other programs, specifically SNAP and Medicaid. It was written before the reauthorization, but I would say that much of it holds true, and we have a number of state examples in that report. It's called Confronting the Childcare Eligibility Maze, and we'll be sure to get it out to all of you. We think that states can still follow those practices with the new law. There's a question about where people can find their state's CCDF plan. So that's a great question. The plans have to be posted on a public website. Presumably what's available now on the Child Care Subsidy agency's website is a draft plan because states have been holding hearings and getting comments on their draft plans. Those final plans should also be posted. I think we don't know specifically when they'll be available. This is a new process in terms of the plans being submitted to the federal office and being kind of so as highly scrutinized this year, right? Because this is really the state's implementation plans. Previously, the state plans were submitted and they were approved, but I would say there was not as much of a robust back and forth between the federal and state agencies. So we don't know exactly when plans will be finalized, other than to say that they're intended to be effective as of June. States should post their final plan up on their websites, but again, if there's some back and forth, we don't know that. I wouldn't say that they're necessarily going to be up as of today, even though this was the deadline for submitting plans. We have heard of at least 2 states that have not made their plans available publicly, even though they are supposed to have gotten public input and have submitted them to the federal agency as of today. If you think that that's the case in your state, I would love to follow up offline and know that, because we are very concerned about those states where we have not seen draft plans at all. Are there any additional questions?
Hannah, this is Gina. We don't have any other questions right now, but I just want to give everybody another minute or so or another couple seconds to send in your questions if you have any. And of course, if you think of a question after the webinar is over, feel free to send those our way and we'll make sure that they get to Hannah. But does anybody have any other questions right now? Please send them in. Hannah, this was wonderful. Thank you so much. Lots of great information, and we will definitely be following up with people with that resource that you mentioned. All right, we don't have any other questions. Hannah, did you want to say anything else?
No, I would just say, thanks again for the opportunity to talk about this. I really, am happy to have conversations one-on-one. We are working both with in some cases, state agencies administering the subsidy program, in some cases state advocates, and we're working at the national level as well on the implementation. So if you would like to get more involved in your state and have questions about that, or would like more information on kind of what's developing in your state, or on connecting with other advocates in the early childhood community that may be actively working on this, we'd love to help facilitate that. So please don't hesitate to reach out.
Excellent. Thank you so much, Hannah. And of course, you are all welcome to reach out to Hannah, as she just mentioned. And if you're shy or nervous about it, reach out to Jen, Suzanne, or myself, and we'll be happy to connect you to Hannah and her team as well. Thanks again, Hannah. This is incredibly informative. And if any of you missed at the beginning, I did mention that we're going to have a recording of this webinar available on our website. We will also have the questions and answers posted on there in case you in case you missed an answer that you wanted to get. We'll have the resources available as well, and then the paper based on the WSS projects that Hannah mentioned. Those will all be available on the website hopefully by the end of the week. So reach out to me if you have any questions. And I want to thank everybody again for taking the time to be with us today on this awesome topic. I know it was incredibly informative for all of us, so we hope you have a lot to mull over for the next little bit on what to do in your state. And of course, we'll be in touch about upcoming webinars, and thanks so much, everybody. Happy Tuesday.